Good afternoon, everyone. Welcome to our program today entitled Transitioning Adults into Living Successfully, also known as TRAILS. My name is Allison Gifford. I am the law librarian with the City of Alexandria, and I am joined by my partner, Kara Wright, who is our library webmaster. And our presenters today are Shamice Alston and Joanna Alering. So without further ado, I'm going to let ladies take over and let them introduce their program.
Hello, everybody. So what I'm going to do now is share our PowerPoint with you so that it just gives us some guiding points. If you have questions at any time, please put your questions in the chat box. Thank you. Okay. All right, everybody. So again, this is our presentation. As Allison shared with you, we are transitioning adults into living successfully, AKA TRAILS. So something we want to talk about with you and make everybody understand is some of the diagnoses that are prevalent in mental health as a whole. So Joanna and I are going to go back and forth and explain some things to you. So just bear with us. And again, let us know if you have any questions. So for example, depression. Depression is one of the first ones that we've listed. And when individuals are experiencing depression, it's more than just a sadness that individuals are experiencing. It can be very debilitating where individuals are struggling with engaging in activities of daily living. So sorry. Sometimes it makes it very hard for them to stay motivated, engaged, whether it's bathing, whether it's eating, and other activities. Joanna, you want to add anything to that diagnosis?
Yeah, so just to backtrack real quick, so TRAILS is an outpatient mental health treatment program, which is why we're starting with kind of some of the generic mental health diagnoses so we can start with some background on mental health. And then as we progress, we'll get into more specifics about our program and other programs within the City of Alexandria. But to go back to depression, like Shamice was talking about, depression, she mentioned we see a lot of changes in mood. So it's not always sadness, like Shamice said. Sometimes there's helplessness or apathy, or in younger people, it can present as irritability or kind of anger at times. People sometimes will overeat, right? Start eating more, or people will undereat. So there's usually some shifts in things that they used to do and from their kind of usual way of living. But depression definitely is a pretty common mental health diagnosis and can present very differently in some people versus other people, but it is still all considered depression.
All right, you want to go to the next one or you want me to jump in?
Sure. So bipolar disorder is also a mood disorder within mental health. That's where, kind of given the name, it tells you there's kind of two extremes that people cycle through, with the bi and the polar part. So there are periods of depression where people exhibit similar symptoms that they do in just straight depression. And then what makes it bipolar is they have moments that are considered either hypomania or mania, where people have excessive energy. They start doing projects, they might do riskier behaviors, things that are abnormal. Usually people need less sleep and are more active and have more energy and no need for sleep. So there is different types of bipolar. Some, like I mentioned, are hypomania. So the mania is not as extreme, and that would be a bipolar 2 disorder. Whereas bipolar 1, it's more of the extreme mania, and you would hit more of the symptoms for mania and depression and cycle back and forth between the two. Not typically in a day, but over a period of time, like a couple weeks or months, people can cycle through the different symptoms. The other one listed is personality disorders. So those are a little bit more different. That has to do with people's behaviors and the way that they act and they interpret the world. That's usually developed over a period of time. And it's called a disorder because some of the ways they navigate life and relationships and things become problematic and get in the way of people being able to navigate, work or relationships and things like that. But those are not easily diagnosed, and they take a long time to diagnose a personality disorder, and they are less common in the mental health world for treatment. And they do require different types of treatment for personality disorders. We don't specialize in that, so that's why I'm not going too much into it. But it is definitely a subsection of mental health that people sometimes seek treatment for.
All right. Well, schizophrenia, some individuals, they experience visual, auditory hallucinations and delusions. So believing things are there that aren't, seeing things or hearing things that aren't actually happening in real time. So that's part of schizophrenia. I know I'm not giving all of the clinical terminologies for it as Joanna would. So if there's anything else Joanna wants to add on to the clinical explanation of schizophrenia, please do.
So schizophrenia is schizophrenia as just schizophrenia is more of a thought process disorder. So like Shami's mentioned, people experience reality different with hallucinations. They also can present with some disorganized behaviors or thoughts where people are talking to you or to a person who has schizophrenia, and it may not make sense. You're talking about one thing and they're responding with something different. So that's kind of an example of how their thought process and the content is disorganized. Sometimes their behaviors can be impacted. So they're not able to actually complete tasks or do things, and it just comes off as very disorganized and doesn't make sense. So schizophrenia typically is considered more of a thought disorder, and it does not have a lot of mood components with like depression or bipolar or mania. However, we do have other diagnoses that are similar, which is schizoaffective, which is they are similar symptoms of the thought process, but then it's also in conjunction with mood disorders, like with mood symptoms. And so differentiating between depression, schizophrenia, schizoaffective, it can take a long period of time and a while for us to kind of figure out as clinicians on what diagnoses are, but diagnoses aren't always the end all be all, but they do help form treatment plans and things like that. But there's definitely a lot involved in diagnosing somebody with a mental health diagnosis. So we're just kind of going over some brief tidbits. So we're not going to get into the nitty gritty here today about all of the diagnostic criteria for each one. And another one listed is another pretty, anxiety is another diagnosis that a lot of people in the general population have as well. Some people go lifetimes with having anxiety and being able to kind of cope with it on their own. Some people it becomes a more clinical need for some treatment and intervention. And so anxiety is, constant, overwhelming, worried thoughts, not being able to kind of do things that they need to because they're worried. They're worried constantly about doing things correctly, doing things the right way. And the worry gets in the way of their being able to function. It's kind of a general overview and description of anxiety. And I can touch on the last one if you want briefly. So PTSD is definitely post-traumatic stress disorder. It's become a diagnosis that's become more talked about, I think, in society and discussed. It's not just, it is, as it kind of talks about, is it's a traumatic response to somebody who's had a stressful event. People who come back from war, like veterans, sometimes they have PTSD. It's not just for people who've been to war. It's anybody who's experienced a traumatic event for themselves. It could be the traumatic event, could be an assault, it could be a car accident, it could be a natural disaster. It's a body's way of reacting and being hypersensitive, hypervigilant. Some people have reduced sleep. Some people have flashbacks. Lots of these symptoms present can lead to the diagnosis of post-traumatic stress disorder. But it is a result of some event in a person's life that has left them traumatized.
Okay. So what is TRAUS? So as Allison tried to give a little bit of disclosure on what our program is. So we are a program designed for first episode psychosis. So individuals who are experiencing episodes of psychosis within the first 2 years of onset. So individuals who are experiencing delusion, changes in their thought processes, visual and auditory hallucinations. So we work with age groups from 15 to 30, and we work collectively within our team. So we're short term, but we're intensive. So as a group, Joanna, myself, and 3 others, we work closely together to help our clients in understanding their diagnosis and navigating the community in whatever capacity that may be. So when we say short term, our program is typically 2 years. Typically 2 to 3 years. We give that time frame to help these individuals understand their diagnosis, develop the coping strategies that are necessary to help them in coping with whatever symptoms have manifested for themselves. And our program is also evidence-based. And sorry, I'm using my mouse as if I'm sorry about my laptop. So our program is evidence-based under the coordinated specialty care approach. And this is an approach that is being used nationally amongst different programs across the country who are trying to adopt a similar model of helping individuals who are experiencing psychosis and helping, again, them navigate the community and integrate back into society. So within our team, like I said, it's 5 of us who work closely together. So Joanna is our therapist supervisor who oversees our program. And then we have another therapist, Katie Aliberti, who also provides services to us. In terms of our therapeutic approach, we focus more on the CBT model, which is cognitive behavioral therapy. In my role, I'm the supported education and employment specialist. And what I do is help individuals who have aspirations of going back to school, going back to work, with navigating their symptoms and triggers to go back into these activities. Then we have Harold Harris, who is our peer support specialist. So he has lived experience of a diagnosis, and he comes in and offers that firsthand lived experience when he engages with our clients. And then we have Dr. Anjali Jindal, who is our psychiatrist. So what we do as a team, I know Joanna, you can jump in at any time, but like I said, we work closely together. So even as though clients are receiving therapy or supported education or peer support specialists support, we all work closely together. And sometimes we have to collaborate together in offering services instead of them meeting just individually with any member on our team. Anything else you want to add, Joanna?
That's a great description and overview of Trails. So we are a part of CSC evidence-based model based off of the RAISE study here in the United States. It's actually also an international program. Europe, Australia have been really instrumental in starting coordinated specialty care, and they're actually 15, 20 years ahead of us in the research and implementation of these programs. So we have a great model to look towards and to see how useful it is. We are one of currently 7 other programs within the state of Virginia who have this grant, who provide this evidence-based program to services in different jurisdictions. Although the great thing is the General Assembly and Virginia has expanded that, and it looks like there's going to be 3 more jurisdictions within Virginia starting to implement these same services within their jurisdiction. So we are considered an early intervention and prevention program. So we are designed to, like Shami said, get in there early to provide intensive support. We are unique in the sense that we are community-based compared to most outpatient services. So we can go to homes to see people, we can go into the community, or they can come into our office. And another key part about our program is we use a shared decision-making model, which means that we work together as a team with the client and their family or their designated support system, and we work together to come up with their best treatment that they want and with their goals in mind. We ask that they take clinical recommendations, but at the end of the day, we respect someone's clinical right to making their own decision for their care. But we engage in conversations and provide, all the information so that they can make the best informed decision for themselves for their treatment. But self-determination and their ability to help choose their treatment is a really big part of our services. And like Shami said, we provide a lot of services together. So we have the individual therapy. We do engage families of people who are adults are willing and wanting their families and support systems so that we can help provide education and support to the natural support system as well. And then we do a lot of case management needs. So if people have identified housing needs or food or other resources that they need, we work in conjunction with them to linking to other community-based resources as needed and as identified when they come into the program.
All right. So something we wanted to do is just share with you an overview of the CSB as a whole. And Trails is just one program amongst many that the city offers to individuals. So something we just wanted to share with you, if you're not familiar, is some of those. So for example, we have outpatient services. So if individuals are just seeking therapy only, that is an option for community members to take advantage of. If they want therapy in conjunction with psychiatry, that is an option. But if they simply want psychiatry, that is something that they can participate in as well. We offer case management services. There are two specific programs, CRT as well as CORE. We'll go a little bit into that in a little bit. We offer substance abuse outpatient treatment services for individuals who are struggling with substance abuse, but also want to work on the therapeutic components to their substance use, meaning what triggers that have kind of led to their use. Then we have intellectual disability services that are offered. We have West End Wellness Center, which is kind of a day program designed for individuals who want support, whether it's peer support, more psychoeducation about their diagnoses and different tools that they can use within the community. And then we have Assertive Community Treatment Act. And this is an intensive program designed to help individuals with severe diagnoses who struggle with navigating the community independently. Anything you want to add to that, Joanna?
So these are all, I just want to add that the Community Service Board is in every jurisdiction, and it's run by the city. For us, the city of Alexandria. For Fairfax County, it'd be the Fairfax, County CSB. So each jurisdiction in the state of Virginia has their own base. It's essentially a community mental health center that prioritizes providing these services to people who are uninsured or who have Medicaid. The CSB does actually contract with a few private insurances, and they will at times take on people with private insurance, but the priority is always and first and foremost goes to people who have no insurance or Medicaid to make sure that they have the resources that they needed, because other private places will not accept a lot of Medicaid or no insurance. So we make sure, our whole agency makes sure that all of these services are readily available to any person residing in the city of Alexandria. Trails is a unique program compared to most of the other services within the CSB, because you can get outpatient therapy through a private provider. If you have private insurance, there's always another place you can go. Trails is a unique program in the sense that private providers do not provide this wraparound intensive CSC model of services. And so we have specific ways of working and trying to work with and accept private insurances. So we do not disclude people from being assessed to see if they are eligible for our program because of insurance. So we do work with people with private insurance and try to work with them. So I just think that's an important thing to know about Trails, is that we are a little bit different in that sense.
Just to add a little bit of what Joanna has shared, again, it is important that individuals go to the right CSB. So for us, you have to be a city of Alexandria resident. And to get services, there's an intake process. So you would contact our intake department, and they would ask you different questions about yourself, and they'll specifically ask about your residential status. So when you come in for the intake, or rather clients come in, they have to show their proof of residency. Something that's important, but to have, if it's necessary, is proof of income and proof of insurance. We understand, because our program is designed for individuals who have low income to no income, and insurance or no, depending on the levels of insurance, we work with individuals. So we do have a sliding scale depending on individuals' abilities to pay for services. So this is something that is provided for each individual, but we do ask that they provide, like I said, proof of residency, proof of income, proof of insurance, so that we have that information in our system and we can bill accordingly. And once individuals go through the intake process, then they are referred to whichever designated team and service that they're interested in. All right. So this was just some facts that I found, since we are speaking to individuals with connections to the law library. So some of the stats, as you can see, is that about 2 million times each year, people with serious mental illnesses are booked into jail. About 2 and 5 people who are incarcerated have histories of mental illnesses. Another key factor that many people aren't aware of is that suicide is the leading causing death of individuals in local jails. So we want to pretty much inform you about some of the stats if you're unaware of, and to let you know some of the connections that are important in terms of mental health as well as the legal system. Any additions to that, Joanna?
I just think it's important to know, sometimes when people go through the legal systems, they already have a diagnosis, and they could be trespassing or petty theft or things like that. Sometimes those are tied into mental health symptoms, and they're not doing well, and they're confused, or they might have some delusional thoughts about where they're going or what's happening. And so oftentimes some of their symptoms can get them, cause them to come into more frequent contact with the police. And that's why it's important, I think, when learning about the criminal justice system, whether it's a lawyer or the people working with inside or the deputies, really assessing for mental health needs for a person who might be entering the criminal justice system, and figuring out how those needs can be met and addressed, whether it's they're on probation or they just got arrested, or at any point during that, because that could have a huge impact in being able for that individual to successfully complete their time in the criminal justice system and kind of get back to work and things like that. So I definitely think it's an important thing to look at and address and kind of factor in and assess for when people are coming in contact with the criminal justice system. Not to say that every person who is arrested has, a mental health diagnosis, or that may be the reason, but it's definitely something to consider and to take into account and assess for.
Okay, so we want to provide you all with some contact information with our city. So Emergency Services, which is a 24-hour program, offers so individuals who are experiencing crises, this is the number that you would call to connect to our services, where they would assess for any mental health needs, whether or not that individual needs to be hospitalized, sent to crisis care, or other avenues need to be taken. Anything else on that, Joanna?
No, I just think it's important to know that it says emergency services, it's emergency mental health services. So it is 24 hours. It is clinicians, licensed clinicians. You usually go through like a front desk staff person, you just ask for emergency services, but it is a licensed clinician that you'll be talking to. And this should not take place of an immediate crisis where somebody's in immediate danger. You can call 911 and ask for police to come, and you could ask for a CIT officer, which is what Shamice will get to in a minute, but those are police officers that have gone through special training within the city to understand mental health and be able to take that into account when they're responding to calls in crisis.
All right. So CSB mainline, this is the main contact number if individuals are looking to connect to other services within the city. So I have listed under there the intake line, but sometimes if someone already has connections to psychiatry or case management and they want to get connected, or you have questions, 50 extension 5700 for the city is the main hub of who you should contact when you want to access other resources or get information, and they can point you in the right direction. And like I said, the adult intake line, that those case managers, intake case managers, what they do again will ask important details about what the caller is calling in reference to, and different information to make sure that they are calling the correct place. If for any reason the individual is not a city resident, or they've contacted the intake department in error, they will, in essence, direct that individual to the correct places, whether that's in the city or other community resources. So like Joanna touched on, crisis intervention team, CIT, Megan Mohan, I hope I'm pronouncing her last name correctly, is the program coordinator. So like Joanna noted, that this is a program about specifically trained officers who work hand in hand with our agency and ensuring that clients or individuals are getting the services, the appropriate services. So there are, like, continued issues where individuals are incarcerated when incarceration isn't the necessary need. It's more mental health based and they need psychiatric assistance. So within that team, they are geared towards assessing the situation and handling it, not necessarily in a legal capacity, but more in a psychiatric capacity. Any more on that, Joanna?
Um,
No?
no, we do have just a note. The CSB does have a mental health team within our jail for the city of Alexandria, along with the people that are listed.
Yep. Pretrial probation services, Director Daisha Hall Winstead. Some of you may be familiar with who she is, or you may not, but she oversees pretrial, so individuals who have gone through the legal system, and there are some connection or need to connect with mental health services. She provides that input and assistance to individuals and ensuring that they're connecting to services with our CSB and connecting to the necessary probation officers in accordance. Okay. And then, we have the Collaboration for Recovery and Reentry, which is CORE, who is supervised by Michelle Albert. So this is a case management team who specifically works with individuals who have some connection with the legal system, whether they're on probation, they are in the pretrial phases, or thereafter. They're working with them again on accessing the resources and services and ensuring that their needs are being met in terms of a mental health and case management capacity. Any more on that, Joanna? Okay. So this is something that some people may know as in the legal world, but these are things we wanted to share with you. So something to keep in mind when you're speaking to individuals is the language and the terms that you're using. Culture plays a big role in how we understand or how we agree and accept things. So for example, there are many individuals who aren't comfortable with seeking mental health services despite their current diagnoses and symptoms that they're experiencing. So sometimes individuals, when you're asking them specifically if they are receiving mental health services, if they have a mental health diagnosis, they may not feel comfortable disclosing their diagnosis or their symptoms, or they may not identify it in such a way. So some ways to look at it is asking if they have support systems, people who are supporting them and guiding them, or if they have any way of identifying the symptoms or the things that are going on inside of them. So sometimes we have to kind of take cues from them in essence of how they respond to us. Another thing to consider when we're working with individuals is patience. And this goes hand in hand with the cultural piece. Sometimes they may not feel comfortable disclosing what's going on with them, providing all of the details. And it's not that they're necessarily being cagey or trying to be deceptive, but sometimes it's finding the right words. It's finding, being accepting of what's going on with themselves to share that with somebody else that they don't know. And as providers, as community members, something we need to work on is showing support and being understanding and letting them know that no matter what, we're here for them. And many individuals, as you may understand, who have a diagnosis have had experience with the legal system, and it hasn't always been great. So they are a little guarded. They are a little worried about what the repercussions may be during this time or in the future time, but knowing that they have the support of you and other people in the community is something that they truly need. Anything else you want to add on that, Joanna?
No, I mean, I think you did a great job of explaining. I think in the few times that we've worked with some clients who've had lawyers and involved in the criminal justice system, it's people don't always want to, like you said, say they have a mental health diagnosis, but they might say they have a counselor or somebody they talk with. So just keeping it kind of general, if you're assessing to see if they have these other things going on in their life, that might be a good segue into somebody opening up and sharing, and then you might get some more information. And hopefully after this presentation, or if you guys ever have questions, we can put our information out there, and we're happy to provide assistance, answer questions about the system or mental health or our program specifically for people. We're always, willing to do that as well. But yeah, a lot of people have some supports and things like that, and they may not openly want to share too much, but if they hear the word counselor or support, maybe they might be willing to open up a little bit more instead of just hearing mental health. Unfortunately, there still seems to be a pretty big stigma when they hear mental health or facilities or things like that, or if they've ever been hospitalized, the fear of potentially going back there as well. So they kind of start to become more guarded. So trying to use more generic terms sometimes can be helpful in getting somebody to feel more comfortable.
Well, that is the end of our discussion, and we want to answer any questions that any of you may have.
Oh, I'm going to jump in.
Excellent.
A great presentation, great information. So I may have missed this, but are y'all involved with the courts per se? So do you ever get clients in lieu of sentence, getting sentenced?
So that's a really good question, Allison. We don't ever get people, to my knowledge, we have never got somebody in lieu of a sentence. We definitely, sometimes we have people who might be already involved in the criminal justice system. And so they want us to support them while they're going through it. And so we are mental health providers. So we follow all HIPAA rules. So we can't disclose any information, even if it's to a lawyer, unless somebody signs a release of information. And then if they do and they're willing, we work with them and their lawyer, and we talk with them. And if they want updates, things like that, we can provide that to them and support kind of going through any criminal charges or pending cases or probation, things like that. So we can definitely help advocate for them if that's something they want. But we would only get involved if an individual wants it. Mm-hmm. We've definitely had cases where we've had some lawyers, or we actually once I got a referral saying a judge ordered somebody to us and said that they had to work with us. So to me, that was great. Our name is getting out for supports. Mm-hmm. Unfortunately, we're a very specialized program. Like Shami said, we're first episode psychosis. So really symptoms of psychosis have to be present, whether we think it's from schizophrenia or schizoaffective or depression with psychosis. There has to be psychosis involved, because that is what our model of our symptoms and our treatment and what we're designed and what we specialize in treating. So if it was somebody who has depression or anxiety, but there's no psychosis with that, we could refer to other places. Mm-hmm. So the big criteria for us is not just that you live here and it's the first time you're experiencing these symptoms. It's that you're having these symptoms.
Mhm.
And that's what we're designed and here to help with, and that's what the model is designed for. So it is unfortunate, there's a lot of people that could really benefit from a specialized model like this in intensive services, but we do specialize in psychosis and really the first episode. So if somebody's had symptoms and a diagnosis for like 4 or 5 years, unfortunately that would be a rule out for us.
Okay. Yeah, sure. And you also mentioned they had to be a resident of the city of Alexandria. I mean, I've noticed, because we're located down on King Street in Old Town. So, the homeless population seems to be growing, just in my observation. Do you handle clients that are homeless? How do you?
Absolutely. We definitely, if that is a tricky question. You're right.
Sure.
They're homeless, so they don't have a house, right? But if they are homeless and they used to live in Alexandria, like they're linked to our shelters, we definitely can help them. And we can assist with helping them figure out their housing piece, because we know stable housing is a key to stability for mental health and important. So a large part of treatment, if somebody is homeless and they want it, that we help look at different community resources and options. Because if somebody is homeless in the city of Alexandria, there are programs and things like that within the city that they could become eligible for, and we can help them navigate that. And then there are special housing programs, mental health housing programs, like group homes for people who are chronically have struggled with mental health and struggled with chronic homelessness. So the city does have a wide different services with regards to housing for people with chronic homelessness. And so, but being attached to mental health services with the CSB is a big way to tap into those services. So it's kind of a long answer, but yes, that would.
No. Yeah, that's great.
Does not preclude them to working with us. It just gives us something else that we can help them with, because housing is super important.
Yeah, and this is a great program. How long have y'all been formed, or how long have you?
That's a great question. So they started in 2015.
Okay.
So we're a pretty newer program to the city of Alexandria. And I guess what we should have also shared is we're sharing the adult side, really, of the adult services. And we spent more time talking about adult services, but the CSB also does provide mental health services for youth and their families. So a lot of what we provide in the adult world is similar, that we have therapy and case management for the youth and their families as well. But yeah, I just realized, I was like, we focused on the adults because we work with more adults, but we do have some minors, because we go as low as about 16, 15.
Wow. Okay.
So that's just not as many of our people, but we do have that. And the CSB definitely has services and supports for youth and their families.
Okay. Yeah, that's I was wondering about statistics, if you had what group you saw most of, as far with this, type of mental illness. Would it be older adults, younger? What do you?
That's a good question. So research shows that typically people with schizophrenia might have their first psychotic episode around the ages of 17, 18, wow. Like teens, early 20s. For men, women have it typically a little bit later, which is like 20s to mid 20s. What we're seeing in the research. I don't really know why men might have their first episode earlier than women. It is known that we don't always know what the trigger is going to be for an episode of psychosis, but typically a lot of times, not always, but a lot of times there's a stressful event in a person's life, like going to college for the first time, getting a full-time job, a master's program. Sometimes a traumatic event can be a trigger, and sometimes like a loss of a family member or something like that can also be a trigger for psychosis, an episode of psychosis.
And so you said your program usually lasts 2 years for a client, and hopefully, what is your hope your goals, shall we say, after 2 years?
Yeah, that's a good question. So everybody's goals are different. We really individualize what each person wants. We hope that they achieve the goals that they want. So whether it's going back to school full time, getting a bachelor's degree for some people, getting an associate's degree, getting a master's degree, everyone's a little bit different. Some people it's transitioning to full-time work. So our hope is that they can go on to fulfill whatever life goal they have with regards to that, and that we would help them build the insight into their symptoms and the coping strategies like Shami's mentioned, and learning how to manage these things, that they would need a less intense set of services. So maybe some people need just medications, some people might want therapy. So really we talk with people about what they may or may not need. Some people might still need some case management a little bit to help kind of manage things. So everyone's a little bit different, but our hope is that they get to move on to what they were doing and what they always wanted to do before their episode of psychosis, and that we just help them find the tools to go back and achieve the life goal that they're wanting with the least amount of support as needed.
Okay, that's great. That's great. Well, that's all my questions.
Those were great questions.
Well, it's very interesting, very, very interesting program. And I can see why. And you've been with it since the beginning, Joanna and Shamiz?
I have not been with it since the beginning. My supervisor is Dr. Rohr. She's still involved. She supervises me and the team as well. And she's been here since she was the first supervisor. So she's still here and involved. So the original supervisor is still with the city and overseeing and meets with us weekly as well.
Where are y'all located?
It's a good question. So our offices are actually at 4480 King Street.
Okay.
Yep. So our main mental health center for the city of Alexandria, where our main outpatient center is, and emergency services and case management's all over at our 720 North St. Asaph Street.
Oh, okay.
Health center. However, we're over at 4480. We are on the 5th floor. We share the building with the health department.
Okay. And you don't have inpatient care by you? No, that's another facility. Okay.
We are all outpatient. The city of Alexandria doesn't provide any inpatient mental health services. They do have some housing programs, but that wouldn't be considered an inpatient. Those are considered like residential and housing group homes. But like inpatient or like hospital, those are all other providers in the community.
Okay. All righty. Well,
thank you, Allison, for your question.
Oh, no, thank y'all for participating and, presenting. It was a really great program. And, hopefully we'll do this again. And thank y'all so much. I appreciate it.
Yeah, I might just share our main number for
Please.
Calls. It's the 703-746-3441. If anybody has any questions about the Trails program or eligibility, or just has a question, they're not sure if somebody has psychosis, but they have concerns, always willing to have conversations or meet with people and kind of help figure out next steps in getting people support. The earlier people can get mental health treatment and intervention, really the better outcomes for the individuals. So we're really big on interventions and intervening, and we're always here to answer a call and try to help link to other people if we're not the right place. So definitely encourage anybody to call and reach out if they have questions.
Okay. Thank you, Shamiz. Thank you, Joanna. And again, if anybody needs any information, you can contact me at the law library, off the Alexandria Library homepage. So thank you all and have a great day.
Thank you.
Thank you, Allison.
Bye.
Bye.
Hold on. Hey guys, hold on one second.